thank you all for coming. Right, so I would like to introduce our next speaker, Dr. April.
There you go. That's okay. It's all good. It's both names.
Exactly.
It's both names. Don't worry.
I'll let you do the formal introduction.
All good.
So I met Dr. April at a home show in February.
Yep.
And my husband was, doing his man thing, looking at the contractors, talking to contractors and everyone, and I was bored out of my mind. So I wandered over to her booth and really just wanted a place to sit, to be honest.
Thanks for being honest.
But she also had this little thing that could check your neck to see where your pain points were. I'm like, well, you know what? I've had this kick in my neck for the past 2 months. I may as well get it checked out. I'm here. It's no charge, right? So I sit down, start talking a little bit, and I was like, let's see how accurate this thing is. So she did it, and it was like spot on. She's like, I bet you're this. I was like, how did you know that? Obviously, she knows her business. So, long story short, I went in. They had a show special running. I did that, got some x-rays taken, decided to become a client. Best decision I ever made. I have been struggling for a number of years with my health, my weight, my everything. As I mentioned earlier, we adopted our now four-year-old grandson, who runs me ragged, but helps keep me young. And I had kind of made a commitment to myself to become healthier so that I could be there for him. I mean, when he graduates, you're gonna be like 70. So that's why I decided to do it. Again, best decision I ever made. I had plantar fasciitis for the past 1.5 years. Had the shot, it lasted a little while, just dealt with it. Other problems, I have knee pain, arthritis, things like that. I hadn't realized till after I started going to Dr. April that my right knee, I had this like bump over it. Like the muscle was kind of off. And once I started walking better, I'm actually walking on the balls of my feet now instead of the sides. My daughter borrowed my shoes once, and she's like, I can't wear these. They roll out. I'm gonna fall. So, walking better. I've gained muscle back in my right leg. I'm just overall more healthy. So, and no, she didn't pay me to say this. I really want you to know it does work. So, anyway, without further ado,
Thank you. All right, so I wouldn't be a chiropractor if I didn't go anywhere without my spine. So we're going to start it with that. Marcia was kind enough to hand out. We brought some packets for you guys on the back of the front page. I'm not going to talk about all the stuff in here. That's for you to take home and look at home. But on the back of the front page, if you wouldn't mind turning to that, because that's going to be what we're going to talk about starting off. So it looks like a big, complicated chart. It's really not. We're going to start right in the middle. I like to be interactive. Let's have fun, and everybody seems like they're a lot of fun here. So, what's this thing? Shout it out. Spine. Awesome. What's this thing right here? Part of your skull. Your skull. Yep, exactly right. And then what sits on top of that thing? Right? And then what's connected to that goes all the way down your whole spine? Spinal cord. Now, that's what a lot of people know, and that's kind of where we end up, and we're like, okay, that was good. So the little things that you see coming out of the side here, those are your spinal nerves, and those nerves connect to every single muscle, cell, organ, gland, blood vessel, every piece of your body. And all the different levels go to different places. We'll get to that in a little bit. So if you look from the side view, we should see 3 different curves. You've got a nice forward curve, a backward C shape in your neck. Then we go the opposite in the mid-back area, and then same thing again in the low back. So when all the bones are in their place and you've got those wonderful curves, you should have excellent health, because your body is amazing at healing itself and taking care of itself and maintaining itself, as long as everything is where it's meant to be. As Amy experienced, we go through all kinds of different things in life, If you look at your chart here in that top left corner, you'll see something called the 3 T's. So we have traumas or physical stressors in our life. So these are things like, how are we sitting at the table right now? Do we sit with our legs crossed? That throws your pelvis out of alignment. Do we sit at our computer desk with a leg underneath us? And many of us are working from home on computers now, and you spend more hours working at home than you do at actual work if you went to the office. You start getting a little uncomfortable because of so many hours that you're sitting there, and you start getting into some very new and interesting positions. Well, those things throw off your posture, and then that eventually can affect your health. So that's one of the things that goes into there. And traumas, you know, we all, when you hear the word trauma, you know, an accident, I had a fall, I had a car accident, but you don't think about the repetitive things that you do every day, such as your work posture, when you're watching your screens, we're always looking down. I mean, take a look around and you'll see every person looking down at that. There's a term for that now called tech neck, and it's gonna be it's already becoming a problem. I have never seen so many straight necks on x-rays in young kids in my entire career. And I worked for a chiropractor prior to this who was my mentor, and that's including the films that I saw, and that was since 1999 when I got involved with chiropractic. It is going to be a big problem. Not only do our kids have straight necks, they also we're beginning to see reverse curves on these kids. And I just had one yesterday that's 15 years old with a reverse curve in their neck. It's scary, but that's not what we're here for. So that is one of the things, so like sitting in classes for our kids. So that's a whole, you want to talk about sustainability, let's get some projects for our schools where we have better chairs and better ergonomic equipment for our teachers, because I take care of all kinds of teachers who teach at the elementary level, and they get the pleasure of sitting in a small kid chair to help out the kids in their class. And it wreaks havoc on them after 10, 15, 20, 25 years of doing this.
Yeah.
So some other areas in that physical stressor department. The second one is toxins or chemical stressors. So this is not only going to include things like our shots that we get as kids, and if you look at the charts, when we were kids and we all had to have our vaccinations to go to school, we had about a half a dozen, maybe a dozen. I'm a 75 born kid, so when I went to school, we had a dozen of those shots. Now the kids going into school, you're looking at 70 shots, you guys. So that is a form of chemical toxin, as well as your prescription drugs, your non-prescription drugs, your over-the-counter drugs, your street drugs, sorry. So all of those go in the chemical toxins department, all included with what foods are we eating? Are they organic? Are they not? How much water are we drinking? So everybody, you have a pen. We handed you out a packet. You have our handy dandy, let's get your spine straight pen. So think in your head, what is your body weight? Write that down. What's that number divided by 2? And that's the amount of ounces of water per day that all of us should be drinking minimum. If you drink a cup of coffee, add a cup of water because it dehydrates you and takes water out of your system. If you drink any alcohol, doesn't matter what it is, add an extra cup of water for every serving you have because that also takes water out of your body. Your body is 70 to 80% of water. We need water. We're definitely not getting enough thoughts. The final T, the emotional stressors of our life. Does anybody here have emotional stressors?
Yep.
Of health, of work, of family, of friends, of raising kids you didn't know you were going to be raising, of taking care of all the people that you take care of. One of those 3 is the biggest stressor on your health. Which one do you think it is? The traumas, the toxins, or the thoughts?
The thoughts.
There you go. Yep. The number 1 stressor. What? Dr. April, just my thoughts will cause my spine to shift out of alignment? You gotcha. All right, so all of those factors will shift your vertebra out of alignment. And when that happens, the nerve that's coming out of that area is now not conducting the messages as properly as it should be. So for people that are in my age category or around my age category, I lovingly say, remember the staticky channel on the TV that we used to have when we were kids? The black and white static, and you didn't exactly get the signal? That's what that's like. Now for the kids now, I say, it's like having only 1 bar of signal on your cell phone instead of 5. The horror! Okay, so when that happens and that nerve is not conducting the way that it's meant to, if that nerve is connected to your heart, your heart is not getting all the messages that it's supposed to. If that nerve in your neck is connected to your thyroid gland, maybe you're a lady who's taking thyroid meds, because mostly it's women that have thyroid issues. It's very hormonal based, which then leads down to your low back, which the nerves in your low back that go to things like your uterus and your ovaries. So that's just to name a few things that we deal with in our practice. All right. If you look in the middle column, you'll see the brain and the body with the arrows going back and forth, because those organs will send the message. It'll use those nerves like a telephone line up to the brain and tell it what it needs and request. I need enzymes, I need hormone, I need hydration, I need rest. And if that signal is only 1 bar instead of 5, you're not getting everything that you need. And vice versa, the brain is constantly checking in. Hey heart, what's up? Hey lungs, hey liver, hey uterus, hey everybody, hey legs, hey neck muscles, what's up? How you doing? What can I get for you today? And if you're only getting the 1 bar signal through there and not the 5, you're not getting everything that you need today, and the tissues are going to start to suffer over time. So this is stuff that is not, things that happen right away. This is things that go on and on and on, which continues here. So when your brain and your body are talking to each other at 100%, then you're going to have 100% function. Everything is going to be doing what it needs to do, and you're going to be in a great space with your health. And then if you have 100% function, go down the line, then your system is going to be operating in a state of ease and a state of harmony. And that we need to be in that ease, that calm, that lovely state, like, well, I was going to say like Christmas morning, except sometimes that's not happy for everybody. But what it is for most people, you're in a state of ease. Everything feels nice and you're feeling calm. And that's when your body's going to be able to heal itself. Heal is the root base word for health. And if your body is not able to communicate properly through those channels and be able to heal itself, then you're not going to express your full health. So now when you are expressing your healing and feeling your health, you're going to feel great and amazing, and that is how it's supposed to be. Does anybody not feel great and amazing?
Yeah.
All the time? You're great and amazing all the time, So now back up. So come back up to the chart where you see the word subluxation there. So because of the stressors that we deal with in terms of our physical, chemical, and emotional stressors, that will shift your vertebra out of alignment, and then that is what causes the distortion of the communication through the nerve. That's when we call it the subluxation. And that's exactly what chiropractic is meant to help heal. So when that subluxation's there, you'll see that there's some big X marks there, because that is now causing nerve irritation. And then now, instead of functioning at 100%, you're in a state of malfunction. And your body can put up with malfunction for a little while because it's absolutely amazing, but it cannot put up with that forever. So when that's occurring, now you're not operating in ease. You're operating from a space of dis-ease, or I've said disharmony. But the longer that goes on, your health is just in deterioration. And then eventually that hyphen goes right away. And what's the whole word that we get? Disease. So that's where we're going to end up. And when the dis-ease is how we're operating, then that is where ill health comes in. And if you look at that, this is poor health, this is pain, this is symptoms, this is not sleeping well. That's a big one for people. Illnesses, disease. So notice there is pain there. Everybody, if you go out, if I stood outside and asked 100 people today, what are chiropractors for? Most of them would say, oh, chiropractors are for neck pain and back pain and headaches. And it is. But the more knowledgeable people of chiropractic know that it is for everything in your system. All right, and so that is kind of the hidden secret of chiropractic. So now when you go through the function, the malfunction, the dis-ease, the ill health, now you feel like garbage. That's not the word that I wanted to write, but I'm keeping it professional. All right, you know what word I wanted to write. So you feel like garbage, but the thing is, guys, that all the stuff that you feel, all the stuff that you're suffering with, that's the end of the road. That's the last signal your body gave you, all right? Your body gives you signals all the time that something is wrong, and we just shove it away because things go away after a couple days and we're like, it'll be fine, I'm fine. See, I'm better, I'm great. Well, that's because your body is intelligent and has innate intelligence given to us by, I say God, you call it whatever higher power that you would like, but God knows that when we're going to be healthy, we need all of those nerves functioning at 100%. So that is what makes us feel terrible. Now, when we feel terrible and we finally admit to ourselves that we need to go talk to somebody about it, we typically do not go to a holistic doctor. We go to a non-holistic doctor. And when we go there and tell them that I feel like junk, what can you do to help me feel better? What do we get? Drugs. We get pills, we get potions, we get lotions. That is one of my great philosophy teachers, Dr. Fred Barge, said, and that always stuck with me. Pills, potions, and lotions. What do pills do? They cover up your symptoms. They cover up your symptoms, and it might work for a little while, but it does not work forever. And then you go back and say, it worked for a little while, but now I'm feeling all the same stuff again. Well, don't worry, we have another pill we're going to add to the one we already gave you, and that's going to be the help. And if that doesn't work, we'll up the thing, there's no end. It goes on and on. They all have side effects that all are put it right in the chemical stressor category, okay? And so chiropractic is the natural, innate way to be able to get your spine back in alignment by using our hands and making what we call an adjustment. And then that gets your vertebrae back in their more proper alignment for the sole purpose of that nerve being able to heal and conduct the messages better so that whatever that talks to, organ, gland, or blood vessel, you're going to be feeling so much better. So my job as a chiropractor is to find the areas that are out of alignment in your spine, get them back, and allow your body to heal. I take away the interference, your body heals. I heal nothing. I don't treat symptoms. I look for subluxations and I get rid of those, and then your body heals. So if you look on the very back page, it says symptoms of spinal misalignment. We'll have patients go through that. I just want to highlight a couple areas. If you look at 1C, the very top bone in our neck, so 85 to 90% of babies born will be born with this very top bone out of alignment in their neck, because when the baby comes down through the vaginal canal, there's 90 to 100 pounds of pressure on the baby's head and neck as they're being born in a normal vaginal unassisted birth. So look at some of the things that go, if you look in the column, possible effects of a malfunction, all right? So in that one, not to do with babies, we'll get to that in a second, but I wanted to mention that because nobody knows that. Look at insomnia, high blood pressure, chronic tiredness. That all can be an effect of having the top bone out of your neck out of alignment, because that is literally where the base of your brain starts to come down and turn into your spinal cord at that level. Every single message in your body goes through that section. So we've even helped people get off of high blood pressure medications. If you look in the column below at 2C, you'll see sinus trouble and allergies. Anybody having any of those yet right now? It's been coming through a lot this week in the office. And you'll notice earache. So lots of babies and kids have earaches because guess what? The nerves that come out of there go into your ears. And so that can have kids getting chronic ear infections. And now you're taking them to the doctor and it's ear infection, antibiotic. Well, guess what? It doesn't always work. We got 2 babies in our clinic right now that have been on 3 or 4 rounds of antibiotics, and it's not helping for the ear infection. But what it does do is screw up your gut because it kills all the good bacteria in your gut. So now they've got constipation issues, not pooping issues. So there's a lot of things going on there, guys. So in the terms of the categories for the traumas, toxins, and thoughts, you want to combat those with 3 things. So in terms of the trauma department, you want to think about, well, for all of them, you want to move well, you want to eat well, you want to think well. So in the moving well department, just getting out and even walking. You know, when we were hunter-gatherers living out in the woods back in the day, we would walk up to 10 miles a day, like minimum, walking around looking for food. When's the last time you walked 10 miles? You know, every day, 10 miles. So we got to move our body more. We got to eat well. Does anybody want to put their hand up and ask me if a food they're eating or love is healthy or not healthy? Are we all clear with that? We all know what foods are good and what foods are not good, right? We all know which ones we should be eating more of and eating less of. So we want to, you know, make better choices in our food, and definitely including with the water. And then in the thoughts department, the thinking, well, this is the hardest one to combat. because you have so many different people with so many different walks of life and what all people go through. So what I'll recommend to my patients when I see that being an issue or a big hurdle for us is listening to guided meditation videos on YouTube is a big help. If you're a prayer or a meditator, I know meditating is hard, that's why I use the guided ones on YouTube. So those are some good ways, journaling. So those are all some of the different examples and samples you can do to think well. So I feel like I could talk about this stuff for hours, so I'm gonna spare you that. If you look through your packet, you'll see, are you in pain and did you know? Giving you some information about the effects of acetaminophen and ibuprofen on your liver and how it's killing your liver. Do these sound familiar? All the reasons we tell ourselves why we don't need to find out more about what's going on in our body. I've heard them all at the Vernon Health Fair every year. I've done it since you've started. Sleep deprivation, because this is a huge issue for so many people, whether you can't get to sleep or stay asleep, there's one way or form of those that people suffer with. Benefits of drinking water, we talked about that. Take your body weight, divide it by 2, that's how many ounces of water a day minimum to be drinking. There's some other tips there. Next page, the benefits of chiropractic adjustments, including for newborns and pregnant women. That's what we specialize in our practice. And then that back page, I had planned on going over a lot more, but we can't go over it all in one day. So there is a lot more things that chiropractic is good for. Please don't pigeonhole yourself in the category of neck pain, back pain, and headaches. If you have any questions, I'm here to help. And if it's for somebody that's not in this area, please come talk to me, because I have a network of chiropractors that I can help to get your people to a really good chiropractor. It's not just about coming to our office here in town. It's about, we would love to get every person checked by a chiropractor, especially babies. So thank you so much for your time, and I hope everybody has a beautiful day. Thank you.
Does anyone have any questions for Dr. April? How?
Do you accept insurance and
We-
Medicare?
Yeah, we work with all insurances. I am a Medicare provider, so you can just give us a call and we'll let you know what it is.
Thank you.
Yeah, you got it.
Anyone else?
What other type of community work or actions are you hoping to do or?
Sure, so I've supported the town in so many ways. I've given donations to Kids Safe for Ages. We've joined you at your bowling events and helped with that. I donate every year to the Parks and Rec for the kids to go to camp, so the kids can go to camp. That is a big deal to me. We support the, I'm so sorry, Michelle, the Vernon
Health Fest.
Yeah, we do that.
Sponsored it every year.
We've been there every year. We just, any opportunity that we can get to share this message, because we just want people to know what the true value of chiropractic really is.
And is there anyone that you are looking forward to partner with for anything?
I'm always open to anything, especially, anything to do with children and health, or going into schools and talking to kids and telling them about chiropractic. That would be amazing. And I'm open to anything that you think that I might be able to help you with, so.
Yeah, I've heard you correct a number of teenagers in the meeting
Yes,
room.
the cell phone posture. Okay, so you know what? Let's end on this. Everybody grab your cell phone, because I know you all have one somewhere. All right, so you'll always see people, they're either standing looking down like this, or they're sitting. This is my favorite, they're sitting like this. All right, so all of that is so bad for our posture. So here's a good way to hold your phone. You take your elbows and you just place them on your rib cage like a little table, and then you hold your phone up here like this. Because even if you start to look down a little bit, it is far better than this. Not only will that make your neck hurt, but that eventually with time, because that's just your dis-ease state. So the longer you do that, the discomfort and the issues will just keep on traveling down, and you can actually end up with severe low back pain from looking at your phone like that. So maybe that would be something really great, would be to get into the schools or whatever, wherever we can talk with kids and talk about that, because it is going to be an epidemic. I already am seeing it, and I'm just one office here in Vernon, so. So share that, and every time you see somebody with their heads down like that, be like, hey, this is how you really should hold it.
That's what I was gonna say, I expected to see everybody in here
Yes.
walking around town like that.
Exactly, so I expect to see everybody like this. All right, guys, thank you. I'm here if you want to.